Hey there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Welcome to this edition of Integrative Movement Insider. And today we're going to discuss one of the most common causes for our clients, your clients, chronic tightness, discomfort, as well as the inability to perform at the levels they need to and or want to, and or do the activities that they love to do. And it really comes down to one thing, our clients' chronic posture and movement habits, and especially, more specifically, their non-optimal and inefficient posture and movement habits related to their chronic habits, how they've been acting their entire life as far as the habits they've taken into their lifestyle. Do they sit for a living? How active are they? How do they perform their activities of everyday life and or sport and or recreation? How is their nutrition? How is their sleeping habits and their recuperation habits? And how have they reacted and responded to chronic things such as injuries, surgery, trauma, which all have an impact on the musculoskeletal system as well as the neuromyofascial system, how the nervous system controls the myofascial system. And that's why your client is developing these non-optimal and inefficient posture and movement habits, because the body's just trying to make things more efficient. Not more optimal, but more efficient to get through everyday life. So that's why some of your clients will come to you and say, many of your clients will come to you and say, hey, I don't know what I did. I just woke up and my back started hurting, or my shoulders started bothering me. I can't reach over my head as much or as far. I can't lift as much weight as I used to be able to. It's not because they just did something yesterday, possibly they did, but it's the accumulation of these non-optimal and inefficient habits over time. And that's why things and conditions like we hear about osteoarthritic changes of the knees, hips, and or spine, which I created a course around, that's why people will come to you and say, yeah, my doctor took an x-ray or MRI of my low back and I have lots of arthritic changes. It didn't just happen. This has been a process set up by the non-optimal posture and movement habits that led to soft tissue changes. So changes in muscles. Some muscles got tight and overactive. Other muscles became lengthened and inhibited. Some fascia got tight and short and contracted and or restricted. Other areas of fascia became over lengthened. It changed the hydration of the fascial tissue. Maybe the individual had a scar tissue or had a surgery which led to scar tissue and adhesions that restricted range of motion. So all these things impact the soft tissue structures. Maybe the discs have become bulged and or herniated in their low back and created compensatory changes in the low back, hips, and or lower extremities. Perhaps the individual has cartilage degeneration in their knee or hip because of these non-optimal strategies like over-gripping, tightening, and or loss of optimal alignment and control of their knee joint or their hip joint. Because what happens after that? So they have non-optimal and inefficient posture and movement. That leads to the soft tissue changes that we discussed. And then finally, the client starts creating, or the body starts creating these osseous or bony and joint changes. What we eventually hear and get diagnosed as osteoarthritic changes. So osteoarthritis just didn't happen. It isn't because your mother had it or your father had it or your client's mother or father or family member had it. It's because they developed these non-optimal and inefficient posture and movement habits that led to soft tissue changes that eventually led to the osseous changes that we now term arthritis or osteoarthritic changes of the spine, hip, and or knee joints, for example. That's why becoming a MedFit specialist is so vital to your career, because as a MedFit specialist, someone who specializes in understanding and addressing the issues that led to the osteoarthritic changes, for example, you can be a great solution and provide your client with a real strategy for addressing their non-optimal and inefficient posture and movement habits. Because your clients have the soft tissue changes, maybe cartilage changes, disc issues, and or meniscus issues if they're talking about the hip, or labral issues of the hip and or shoulder. They have the osseous changes. The thing that you can do and to change and impact your client the most is to address their non-optimal and inefficient posture and movement habits. And that's what being a MedFit specialist is all about, and why we train people in the integrative movement system. Because the integrative movement system, our proprietary system that we created and use with our own clients and patients here in our office, is exactly the strategy for addressing those non-optimal and inefficient posture and movement habits. Because when you specialize, you can differentiate yourself in the industry. Because too many individuals in our industry, fitness professionals, they're just trying to attract everyone and they look and sound like everybody else. But when you have a specific way of communicating to your clients and your potential clients, and you address their issues we're going to help you create more optimal and efficient posture and movement habits so you can continue and or get back to those things that you need to, love to, and want to do. You're able to differentiate yourselves from all the other individuals that have their websites with their shirts off and they're addressing, get stronger, get faster, get quicker, the high intensity type workouts. You address the clients that actually are looking for a specialist just like you, which leads us to the second value of being a MedFit specialist, is that you can be a specialist and have greater impact and charge more money for your service because you offer something that is different than everyone else in the industry. And that's what clients will pay for, and they're looking for that. So you have better impact on your clients, greater impact on your clients, and then you generate better income and greater income. And finally, satisfaction. Your clients are in it for longevity. When you work with the baby boomers and seniors, for example, your clients, they want a sustainable strategy to help them age gracefully and be active. They know they're going to live a lot more years. They want to have a fulfilled life. This strategy, using the integrative movement system and the principles as part of your MedFit specialization, will really help you give your clients what they need, a sustainable strategy for longevity. It will also improve your longevity in your career and this industry, because the average personal trainer lasts about 3 years. 3 years in this industry and makes less than $30,000. That's not a sustainable strategy for your life if you have ambitious goals and you want to support a family and you want to give to your charities and you want to have nice things in life, because that's why we do what we do, to help people, to change lives, to transform lives, but then also to have a nice life for ourselves. So if you want to differentiate yourself, become a specialist. If you want to have greater impact and income, become a specialist. If you want to have a sustainable career, want to transform more lives, increase longevity in your clients' lives, become a specialist. We have great opportunities coming up here in the next few weeks. We're going to be, Janice and I will be on the West Coast in San Fran at the Medical Fitness Conference. Lisa Dougherty created the Medical Fitness Network, and we partnered with her, and I'm actually on the board of the Medical Fitness Education Foundation. So we are helping to create awareness around medical fitness and the importance of medical fitness in our industry, because medical fitness is the solution to the healthcare crisis. And that's why this information is so important and can be so impactful in your career if you decide and when you decide to go that route. We'll also be at Rejuve Medicine in Minnesota, St. Cloud, Minnesota. We're going to be speaking to medical doctors and chiropractors and other healthcare professionals and fitness professionals that are in this realm, looking to change the healthcare paradigm with regenerative medicine techniques such as prolotherapy, PRP, stem cell, and to combine this with, our talk is going to be about combining this information with being a medical fitness specialist, because what we're doing is we're training individuals just like you to go into medical practices and become a MedFit specialist. So you need the education, you need the skill set, you need the mindset, you need the communication to help your clients and help patients understand the importance that they are in control of their health care. And with these regenerative medicine processes and procedures, there's no better way to deal with chronic musculoskeletal issues, chronic posture and movement issues that led to those issues in the first place, and really give clients and individuals, patients, a sustainable way to accomplish their health and fitness goals. So check out IIHFE.com, the Institute for Integrative Health and Fitness Education.com, for where we're going to be, so that we can work with you to develop you into the specialist, that medical fitness specialist, so you differentiate yourself, so you have greater impact, greater income, greater client outcomes, and you can be a valuable resource for our clients and patients that need your services and be part of the health care solution. And really, the solution, because what's the solution? Improve mindset, have a better, more positive outcome and mindset outcome-based approach, have a better posture and movement strategy, have better nutrition. There's no better professional than you as a health and fitness professional to bring that message, teach that message, communicate that message, and deliver that message to your clients, your potential clients, and patients in a medical setting. This is Dr. Evan Osa with the Institute for Integrative Health and Fitness Education. I'll be discussing more about medical fitness and how to become a medical fitness specialist, and the skill set, the mindset, and the communication skills you want to have and need to have if you're looking to go down this route. So thanks for watching. We'll catch you later this week at Integrative Movement Insider. Take care.